This evening, I am going to go over the medication in my hands called Mucinex, which is the brand name, but it also has some medications that are mixed together, which helps controls your cough, relieves nasal and chest congestion, and thins and loosens mucus. All right, so this is called a Mucinex Fast Max Severe Congestion and Cough. The medications that are in this bottle, uh, and I'm gonna butcher these names. All right, dextromethorphan, which is a cough suppressant, guaifenesin, which is an expectorant, and phenylephrine, which is a nasal decongestant. So we killed three birds with one stone with this medication. um, let me see. So this medication use is to help loosen up mucus and thin out the bronchial secretions to rid the bronchial passageways of bothersome mucus and makes coughs more productive. So basically, this is where the expectorant comes in, and also this is one of the uses for guaifenesin, which is Mucinex. All right. It temporarily relieves cough due to minor throat and bronchial irritation, as may occur with the common cold or inhaled irritants. It also relieves the intensity of coughing, the impulse to cough to help you get to sleep, and also it relieves nasal congestion due to a cold. All right. Some of the warnings that are very important for patients to know is if they're taking the MAOI, which is a certain antidepressant for psychiatric or emotional conditions or Parkinson's, or for 2 weeks after stopping the MAOI, do not use it. And then if patient education, you would say, well, if you do not know if you're taking an MAOI, you need to contact your physician, your doctor, or the pharmacist. All right. If you another patient education would be you ask the doctor before if you have heart disease, high blood pressure, thyroid disease, diabetes, trouble urinating due to an enlarged prostate gland, persistent cough such as persistent or chronic cough such as occurs with smoking, asthma, chronic bronchitis, or emphysema. Also, the cough that occurs with too much mucus or phlegm. A main patient education moment for this medication is when using this product, do not use more than directed. All right. Also, patients should know they should stop the use and ask the doctor if they feel nervous, have any dizziness or sleeplessness. Symptoms do not get better within 7 days or occur with a fever. The cough lasts more than 7 days, comes back, or occurs with a fever, rash, or headache that lasts within the 7 days. These could be signs of a serious condition. One of the contraindications for pregnant women, they would have to ask their doctor. So you want to keep the reach out of children in case of an overdose. You would like to get medical help, or you will call the contact poison control right away. So the directions is that you do not take more than 6 doses in any 24-hour period. You measure with only the dosing cup provided. Do not use the dosing cup with other products the dose as follows, as directed by a doctor. Adults and children 12 years of age and over must use 20 milliliters in the dosing cup provided every 4 hours. And also children 12 under the age of 12 should definitely not be using this medication. Other medication information will be each 20 milliliter contains 12 milligrams of sodium. Also, you do not want to refrigerate this medication, and you would like to store it at room temperature between 68 and 77 degrees Fahrenheit. We have some inactive ingredients that also comprise of the medication, and also it has instructions for the user to call the direct line if they have any questions or if they have any side effects to report them. See. So the evaluation of medication effectiveness that the nurse would evaluate would be that the patient has absence or a decreased episodes of coughing. And normally most coughing suppressants, depending on the drugs that are in it, they either break up the mucus or they help the mucus come out of the lungs, and to also decrease the irritation of your throat from coughing. Let's see. So the and also for the therapeutic use, it can reduce pain when it is combined with an opioid. Honestly, I wouldn't suggest patients to combine these medications because there could be adverse effects combining both an opioid and a non-opioid together for decreased cough, in which they need to go to the doctor if the symptoms persist. But also it is derived from opioids because it can suppress the cough through by acting on the central nervous system. Let's see. Also, another tidbit would be it has a potential for abuse and can cause euphoria in high doses, hence why it is very pertinent that patient education is key to not only for the patient to feel better while using this medication, but to also be cognizant of the medication that they're taking and what to do if any side effects occur. Let's see. Some of the medication administrations, it can come in the formulations such as like syrup, or it may have alcohol or sugar in the medication. Hence, let me see real quick. We are at 10 minutes. Jesus. Hold on. So it does have like sorbitol, sucralose, citrate, dehydrate, xanthan gum, and bread number 40, glycerin, and hydrogenous citric acid. Honestly, I will also tell the patient if they're allergic to any of the inactive ingredients such as soy, for example, or red dye number 40, then I would highly suggest they will take another form of Mucinex that do not contain soy, sucralose, or red dye number 4. So also this medication does come in capsules, lozenges, but lozenges are only appropriate for those who are 12 years of age and older, and liquid inserts. And another piece of client education that I also would discuss with the patient is to change positions slowly and lie down if they're feeling dizzy. This reduces the risk of injuries, especially with older people, which can possibly cause some sedation, drowsiness, and also those who are first time taking this medication, they should not operate or drive any heavy machinery until they know how this medication interacts with their body, because they do not know if this medication has the possibility to cause drowsiness and sedation. Let's see. Let me give some more. But yes, so basically this is how the drug works. I don't want to make this video too longer than it has to be, but it is in syrup form and it is red, and this is the measuring cup that is used to administer the medication. So the cup only goes up to 20 milliliters. Anyway, it goes up to 20 milliliters. So that is 4 teaspoons. Yes, 4 teaspoons. So because 1 teaspoon is 5 milliliters, so this cup goes all the way to 20. So this also is the recommended amount for that the patient needs to take. Another thing would be is, especially the medicine cup, patients should not use regular tablespoons that they eat dinner with to administer this medication, and to also not to give it to children as well. Another thing is they need to make sure that they drink water after taking this medication, to basically to get rid of the aftertaste, and to also make sure that when they are administering the medication that they are on a flat surface. I'm not on a flat surface, but they need to be on a flat surface in order to measure the medication accurately in the cup. And then once the medication has been completed, then they need to rinse out the cup and make sure that they keep this medication out of reach of children, just due to safety reasons and possible overdose. And also it says here, maximum strength per 4-hour dose is tamper evident. And you want them to know, do not use a neckband. Do not use if neckband on the bottle cap is broken or missing. This also is basically another safety precaution to let to let the patient know that this medication was not safe for administration if the bottle has been already previously opened or tampered with. But for the most part, that is the main talking points of this medication, the Mucinex, which has basically 3 medications combined in this bottle. Also, just keep in mind it does controls the cough, which is the dextromethorphan. Relieves nasal and chest congestion, which is the phenylephrine, and the thin and loose mucus is the guaifenesin, or expectorant. Um, I hope this can excuse me, I just had a blank moment. This concludes the medication of Mucinex for the respiratory system.